For years, you've been told that a blood pressure of 120/80 is the gold standard for health, and if you're like millions of others, the stress of trying to meet that target can feel overwhelming. But what if, for people over 60, aggressively chasing that perfect number is not only stressful, but could be more dangerous than helpful? A landmark medical study that changed the official guidelines also revealed a dark side: a higher risk of falls, kidney damage, and other serious problems that are rarely discussed. Today, we're pulling back the curtain on that study to find out what your blood pressure target should really be. For decades, the approach to blood pressure seemed relatively stable. Then, in 2017, the major American cardiology and heart associations released new guidelines that changed everything. The threshold for high blood pressure was lowered from 140/90 down to 130/80 for all adults. Overnight, millions of Americans, particularly older adults whose pressure might have been 135 and previously considered normal for their age, were reclassified. This wasn't just a change on paper, it changed how doctors prescribed medication and how we, as patients, viewed our own health. A huge driver behind this monumental shift was a major research project called the SPRINT trial. Let's break down what this study did, because it directly impacts the advice you might be getting today. Researchers took over 9,000 people, all over 50 years old, who were considered at high risk for heart disease. This means they already had factors like high cholesterol, were smokers, or had existing signs of plaque buildup in their arteries. They then split them into two groups. The first group received standard treatment, aiming for a systolic pressure, that top number, of less than 140. The second group received intensive treatment, with doctors using stronger medications, or more of them, to push their systolic pressure all the way down below 120. After 3 years, the results were significant. The group aiming for the lower 120 target had fewer heart attacks, strokes, and heart failure. On the surface, that sounds like a clear victory. A lower number is always better, right? But this is where the story gets more complicated, and why your personal health journey matters more than any single study. The group receiving the intensive treatment also experienced a much higher rate of serious side effects. Let's be very clear about what these side effects mean in the real world. Hypotension, or low blood pressure, isn't just feeling a bit woozy. Imagine standing up from your favorite armchair to greet a grandchild, and suddenly the room spins. You have to grab onto something to steady yourself. Now imagine that happening several times a day. It can lead to a fall. And for someone over 65, a fall isn't a minor event. It can mean a broken hip, months of painful rehabilitation, and a frightening loss of independence. It creates a new, persistent fear that makes you hesitant to walk to the mailbox, play with your grandkids, or even move around your own home. This is a devastating blow to one's quality of life. Furthermore, acute kidney injury isn't a temporary issue. It means your body's essential filtration system is struggling, leading to a profound, bone-deep fatigue that no amount of sleep can fix. The benefit of a lower number on a chart suddenly looks very different when weighed against the real-world risk of a life-altering fall or organ damage. It's also crucial to understand who wasn't included in this landmark study. The SPRINT trial excluded people with diabetes, anyone who had suffered a past stroke, and those living with dementia. Think about why this is so important. For instance, diabetes affects blood vessels in a very specific way, often making them more prone to damage. Applying data from a non-diabetic group to someone with diabetes is like using a road map for a different country. The terrain is fundamentally different. Similarly, someone who has had a stroke has a unique brain circulation that needs to be protected. Lowering their blood pressure too much could risk reducing vital blood flow to delicate brain tissue. The study's conclusions, therefore, simply cannot be applied universally to the very people who are often most concerned about their blood pressure. Just a quick pause here. If this information is already changing how you think about those official guidelines, and you believe this is an important conversation, please help us spread the word by hitting that like button. And to make sure you don't miss future videos that question the status quo, be sure to subscribe. It helps more than you know. Now let's talk about why this all makes perfect sense for the aging body. This is where we shift from looking at general guidelines to focusing on you as an individual. It's completely natural for blood pressure to gradually increase with age. Think of a brand new garden hose. It's flexible and pliable. Now think of that same hose after 10 years in the sun. It's stiffer and less forgiving. Your blood vessels undergo a similar process. As we get older, they lose some of their youthful elasticity due to changes in proteins like collagen and elastin. In some ways, this stiffening is the body's natural adaptation to ensure that enough blood, carrying vital oxygen, can still be pushed with sufficient force all the way up to the brain, against gravity. Forcing these aging vessels to relax too much with aggressive medication can sometimes work against your body's own wisdom, risking brain fog or lightheadedness. So how do you navigate this? You become an active, informed partner in your own healthcare. Here is your first actionable step. Start tracking your blood pressure correctly at home, not just once, but consistently. This gives you and your doctor a much clearer picture than a single, often rushed reading in the clinic. Sit quietly for 5 minutes with your feet flat on the floor and your arms supported at heart level. Take 2 or 3 readings a minute apart and log the average. More importantly, next to the number, make a small note about how you felt that day. Did you feel dizzy, energetic? Did you have a headache? Foggy-headed? Note the time of day. This information is gold. This simple act of bringing your own data and asking thoughtful questions fundamentally changes your role in the exam room. For many of us, it can feel intimidating or even disrespectful to question a doctor's recommendation. We were raised to be good patients who listen and comply. But a good doctor wants an informed partner, not a passive follower. You must remember that how you feel, your subjective experience, is a crucial piece of medical data. A doctor can't feel your dizziness or your fatigue. Only you can report that. When you do, you provide essential clues about how a medication is affecting you. It shifts the goal from simply lowering a number to improving your overall health and quality of life, which should always be the true objective. Your next step is to use this log to have a better conversation with your doctor. Instead of passively accepting a new prescription, you can now ask powerful, specific questions. Try asking something like this. Doctor, I see my pressure is 145 today, but my log shows it's usually lower at home. Given my other conditions and my risk of falling, what are the real benefits versus the risks for me, personally, to get that number down to 130? Or you could ask, are any of the symptoms I've been feeling, like this lightheadedness, possibly related to my current blood pressure medication? Could we perhaps try a lower dose first and see how I tolerate it before going higher? For many older adults, especially those who are frail or managing several health conditions, a more conservative target of less than 140 or even 150 might be far more appropriate. The goal is to find a balance, to lower the risk of a major cardiovascular event without introducing the new risk of falls, kidney problems, or a diminished quality of life. This is not to say that high blood pressure should be ignored. If your top number is consistently above 170, or the bottom number is above 100, that is a danger zone for most people and absolutely requires medical intervention. But the vast gray area between 130 and 160 is where personalized medicine is so important. The ultimate bottom line is this: you are not a statistic in a study. Your body is unique with its own history and circumstances. A doctor who understands your entire medical history, your lifestyle, and how you feel day to day is your most valuable asset. Their judgment, in partnership with your own informed perspective, is far more important than any general guideline. What is the one thing you've heard today that you will put into practice? Will you start a detailed blood pressure log? Will you prepare a specific question for your next doctor's visit? Commit to one small, achievable step in the comments below. Your comments are so valuable, and if this video has helped you, sharing it with a friend or family member who might be facing these same concerns could make a real difference for them. Ultimately, this is about shifting the conversation from one of fear and numbers to one of partnership and well-being. Always remember that you are your own most powerful health advocate. Thanks for watching, and until next time, please take care.